Okay, thank you. Hello, everyone. Thank you. So, sorry about the resolution, the screen size. It's too many slides for me to rearrange it to fit properly today, so we just have to come a bit closer if you can't see. But I'm here to, as I was introduced, to talk about Pekkton on implants. It's a material I've been working with now for around 2 years, and the majority of my cases that I do, large implant cases, now utilise the material. I've got a background of working with polymers, even though I am a ceramist by trade. I run and own a dental lab in Leeds in the UK, and I still work at the bench pretty much every day. But when I started working with polymers, I saw an instant area that wasn't being tapped into by majority of the labs that I knew and the companies that I work with. And I saw the advantages of using polymers for making implant cases, and I'll go through those with you today. So some sort of key words that we have when we're talking about Pekkton and polymers in general: patient-friendly, aesthetic, shock absorbent, similar to dentine, and lightweight. These are all phrases that I automatically think of when I'm thinking of polymers and thinking of Pekkton. And these are important factors, and I will go into more detail why I feel they are important factors. But just to pick one, for instance, shock absorbent. When we're talking about natural teeth and restorations on natural teeth, we have a periodontal ligament, and we have lots of tissue around that ligament, which allows for movement of the teeth under compression. When we bite, when we chew, the teeth have mobility. And when we take those teeth out and we replace them with an implant which is fixed into the bone, that doesn't allow for any movement. And if you go to take a fully edentulous patient and you put in implants in the upper and the lower jaw, the maxilla and the mandible, then the patient can often lose proprioception as well, so they can't really tell how hard they're biting together. So for me, it's really important to have an interface between the implant and the restorations, which allows for some compression while the patients are chewing. A word that's missing off of this, which I'm glad it's missing, is flexible. Because a lot of people do say flexible, and I might even say it myself at some point in this lecture, but we're not really talking about a flexible material. We're talking about a material that does allow for some compression, which is completely different to flexation. So I just wanted to clear that up straight away. So when we talk about Pekkton, we can look at what we've got here, the pyramid of performance. And right at the bottom of the pyramid, we've got PMMAs, which are obviously like denture tooth and acrylic type materials. Then we've got some engineering polymers, which are probably not too suited for dentistry. And then we start moving up the pyramid towards the high performance polymers. And a lot of people would be familiar with PEEK, and I've worked extensively with PEEK for about 7 years now before I switched to Pekkton. And we know these materials have lots of benefits when we're working with them. And Pekkton sits directly above PEEK in this performance pyramid. So PEK is a different material. It is not PEEK, it is PEK. And I'll explain the differences between those as well. But this sort of slide shows roughly what the difference is. So they've got a PEEK molecular chain at the bottom, and then at the top there's the PEK molecular chain. And the difference simply is one factor, and that's that we have an extra ketone in Pekkton. And that extra ketone, which is this area here, adds rigidity to the framework material. So with some of the competitor materials or some of the PEEK materials that are on the market, you can get too much movement and too much flexation when you're doing, say, a classic all-on-4 type restoration where you've got large spans between the implants. Then sometimes what we found historically working with PEEK is that we needed to reinforce those materials either by putting a primary bar down first and then processing over the top of the primary bar, or finding some fibrous reinforcements around the material. With Pekkton, we now realise that the extra strength that we've got there, we can go straight to fixture, titanium fixtures screwed into a patient's mouth, all on 4, all on 6, or as many fixtures as you need, and we can do that without using a primary structure. So we've just got one framework material in there. So again, looking at some of the scientific sort of studies and graphics are focusing on Pekkton. We can see, you might not be able to see too well, but this is where we've got Pekkton here. This one on the left, and in terms of modulus of elasticity and compressive strength, it's up there with cortical bone, which is this in the middle here. It's right on a parallel with that. And when we're looking at human dentine as well, it's around the same factor. So again, we're not replacing, we're not trying to better nature, because nature cannot be bettered, but we can try to recreate it, and these materials put us straight back into the zone where we want to be in terms of how a material reacts when we put biting forces onto it. And again, just another graphic that shows the compressive strength, and it is just virtually identical. It's in between human bone and human dentine, and we are making teeth with these things, so this is what we want to be looking at. So we've got some more factors here, some more numbers and figures, and whether they mean much to you or nothing to you, I can quickly sort of run through these now and explain the whole point of them. So we have compressive strength, which is how something is almost squashed together, and then we have bending strength when you have a length and something bends. So when we're looking at these factors and we're comparing to the other polymers that are on the market, Pekkton outperforms in terms of compressive strength, bending strength, flexural modulus, and elastic modulus, and tensile strength. All of these factors is higher with Pekkton than with the competitive products, and it's a factor from anywhere ranging from 5% in terms of performance improvements, as high as 80% with some of the materials, especially compressive strength. Compressive strength is the one that we're really focused on here, because that's the thing that's going to stop our restorations flexing too much and delaminating the ceramic or the composite or the acrylic. We want these to be fixed without having to go to the added expense of a primary bar. So that compressive strength is a real important one in terms of how we use Pekkton. And one thing again to draw attention to is this number here at the bottom. Hardness is a very specific test, and because polymers are not hard, you can puncture, you can scratch the surfaces easy. They have to come up with a new test for measuring the hardness of polymers, and this is the result. So it's done with a ball rather than a point, and that is the only difference. But it's important to explain why why it's different to standard hardness tests. So what got me sort of excited about working with Pekkton and polymers, it was this slide alone, really. When I first looked at this a couple of years ago, and I saw how titanium and how gold react under stress, and you can see straight away all the stress gets focused in very specific points, and it finds weak points, and if the biting force is above that pontic or those connectors, that's where all the stress is going to go. Where at the bottom there, we have the stress transfer on Pekkton, and the immediate sort of stress is dissipated throughout the entire framework. So this is very useful for me as an implant technician, because when I'm restoring a full maxilla, generally speaking, a lot of the time it's not a full upper and lower case. We get a lot where we're just doing the upper arch, and what we tend to find is we have a sporadic placement of lower teeth opposing. So we might have partially edentate with sort of partial dentures in the lower and a few teeth here and there, and then we've got this full arch upper bridge. Now a big trend in the UK is the all-on-4. I'm a big fan of putting more fixtures in personally, but nevertheless we have to restore a lot of all-on-4 cases. And when you are talking about implants and about occlusal management, the thing that we're all taught and we all know as gospel is to try get the biting forces directly on the fixtures, where the fixtures are. Now, if you've got a partially edentate patient that hasn't got teeth where the fixtures are, it's impossible to do that. So having a framework material that allows this transfer of the stress throughout the framework rather than just at the point of contact is an added bonus for working with Pekkton in partially edentate opposed teeth, opposed mouths. So, other material benefits that we get with Pekkton. Obviously, it's a metal-free restoration. There's, it is a polymer. There's no alloy in it. There's no nanoparticles. There's nothing in the Pekkton. It's a bio-inert material. So with that, we get no worries about allergies. There's going to be no allergies or no reaction to Pekkton. There's never been an observed reaction to these polymers in human. So we know that they're completely bio-inert. They're taste neutral as well, so there's no metallic taste or anything like that with them. They're just almost non-existent when we place them in the mouth. And again, we're looking at the modulus of elasticity similar to bone. But again, I don't really like the term flexible because it gives the wrong idea. I used to really like the term flexible, but I think when we think of flex, we think of stuff bending. And when we look thinking about implants, the last thing we want is stuff bending that's holding the implants together. So this stuff doesn't bend. If you bend it, it'll snap, but it does allow for compression. It's a shock absorber rather than a flexible material. And again, yeah, shock absorbing during chewing. It's got high resistance to wear and abrasion and corrosion, so basically, I mean, we wouldn't personally choose to make a full contoured restoration out of Pekkton. It's not really tooth coloured, it's more bone coloured, so it's not what you would choose to make a full contour restoration, but the fact of the matter is sometimes we will have palatal aspects or biting planes on that are just pure Pekkton, and we know that they're going to wear very well in comparison to enamel and dentine. And this is not so much really a focus on implants, on this particular aspect of Pekkton, because I do, generally speaking, just use Pekkton on implant cases and not on natural teeth, unless it's for, say, maybe a really long-term temporary solution. But if you do, and lots of people do use these as permanent restorations by just putting composite on some Pekkton and fitting that on natural abutments, and because of the radiolucency of the material, you can x-ray through the material and manage caries underneath. You can see if there's anything under there, which obviously you can't do with metal substructures. So that's mainly just for natural teeth, not so much a bonus on implants, but it's worth pointing out. Excuse me. The material can be sterilised, and there's no thermal or electrical conductivity to it, so it's not going to transfer any heat through the framework at all. And again, proven long-term biocompatibility. I'll talk about that in a very short while, but we know that these things, bioinert is the correct term rather than biocompatible. They just have no reaction in the human body, so we don't have to worry about things like inflammation because of reactions. It's not going to happen. So strong and very lightweight, and this is true. This is very true. When we look at a full arch metal ceramic bridge, or full arch zirconia ceramic bridge, or titanium ceramic bridge, we're looking at something that weighs anywhere from 60 to 100 grams in weight. And when we look at a full arch Pekkton bridge, generally speaking, if it's just composite or acrylic on there, it's down below 10 grams. And if we're putting ceramic teeth onto the Pekkton, it's below 20 grams. So this is a great benefit to patients. And because we do put ceramic teeth on, the patients really find that it feels natural to them. It doesn't feel like it's artificial, like it should be there. And for me, working with a lot of patients and seeing a lot of patients, and what happens with the majority of the cases that we will deal with is a patient will go into a dentist with a few failing teeth, periodontally involved teeth, and right or wrong, the dentist will then choose to do an arch clearance. We'll fit a bridge on the day, usually a hybrid of a denture, so it's just pure acrylic, and we leave that as long as it's needed until the implants are, and the dentist is happy with the stability, and we're ready to move on to final restoration. And one thing that a lot of the patients, in fact, probably as high as 95% of the patients we've treated with Pekkton say to us, when we take the old acrylic hybrids out and then put these new Pekkton bridges in, they say they feel like teeth, they feel like they should be in my mouth, which gives us a massive confidence in patient acceptance when we deliver these bridges to the surgery. The last thing we're going to expect is a patient to say, it doesn't feel right. And we have had that in the past with other materials. And I'd like to point out that when we have an area of the brain, the parietal lobe, which is the sensory area for all sense and touch. And if you look at this part of the slide, you can see that how much of that lobe is given over just to the face, the tongue, and swallowing. So there's a lot of sensitivity in the patient's mouth. And if anyone's ever had a brace or wore any orthodontic appliances or anything like that, I know that when I did as a child, when I left the dentist, I felt like my top lip was out here, and I felt almost like I had a duckbill. And when I got home and looked in the mirror, it was just not, I couldn't even tell I had it, but it's how it feels. So for me, putting a restoration in a patient's mouth that feels like it belongs there is a massive psychological bonus for the patient. So talking about the lab processes, we can do this a traditional way, which I call traditional way is more of a hands-on sort of thing. So we make a wax pattern or a plastic pattern, and then we invest that, we burn that out, and then we melt some Pekkton, and using the Pek press or using a standard burnout furnace, either work well, and then we transfer that across to the Pek press, this machine here. And very similar to how you would an Emax crown, you just press the Pekkton into the shape that you've burnt out. There's a different procedure. You don't melt the Pekkton anywhere near as high a temperature as Emax. You melt it at around 390 to 400 degrees centigrade, and that will melt your Pekkton. And then once it's melted, it goes to a chewing gum consistency. You pop it in the Pek press and one button and it's done, it presses. Now once this material has pressed, within 40 minutes you can devest, sandblast, and you're ready to work on the material. It's really quick turnaround. And in terms of cutting the sprues off and things like that, if anyone's used to working with cast alloys, it takes a long time and a long time to sprue reduce. You can cut off 6 sprues and take the sprues down on the Pekkton framework in probably less than 2 minutes. So it's very quick working time. Once it's pressed, you're working on it in a matter of minutes rather than spending hours grinding. And again, you can use the Dekema Pressident as well to press Pekkton. We've got a Dekema Pressident at the lab. We don't really press Pekkton in it because we have the Pek press, which is perfectly made for it. We get very few problems, if any, now pressing Pekkton. Everything presses perfectly in this machine. We used to use the Dekema before the Pek press was brought out, and also if anyone has a bio-HPP machine, you can press Pekkton in that exactly the same in the Reddington 4.2 press. But these are the machines this is the machine that we use. We had a 4.2 press, we don't use it anymore. We press everything in the Pek press. If pressing's not your thing, if you like to mill, then milling pucks are available. The standard 98-point mill pucks are available, and I think the Zircon's arm pucks are already available, and the arm and gearbox ones will soon follow. So pretty much any milling machine that's out there, you can get a Pekkton puck. If not already, then very soon, and you could do the milling, or so you can traditionally process it, or you can just mill the stuff. And either's fine, and I have no preference. We mill and press at the lab. The larger cases we tend to press, the smaller ones we tend to mill. Now, talking about polymers, and particularly Pek, it's been around for a long, long time. Medically, we've made lots of different types of devices out of Pek. We've made cranial implants. There's been tibia and fibia implants. Every part of the body that can have an implant really has had one made out of these materials. Even spinal implants. We have all sections of spines that have been made out of Pekkton. So it's been used medically for a long, long time. It's just newish to the dentistry field, but in medicine it's been around forever. And even implants now are being made out of these materials. Whether it be PEEK or Pek, there's in vitro studies going on as we speak now with these implants. My personal feeling on implants being made of Pekkton is probably, or any PEEK, it's not going to be the future. I think the future is definitely having the material as the interface and keeping with titanium standard implants. The problem that we might occur, or the problem that I see occurring, is too much movement of the material, especially the PEEK implants. And if we got any movement around the bone, it will get resorption around it. So I think keep the implant rigid, make the interface the compressive part. But still, it's an interesting study, and we'll see what happens. One thing that has happened already is we've seen a big switch now in the inserts for things like locators, and here we've got the CM lock, which utilises Pekkton as its interface. So again, standard as you get with like most locator systems, you have 4 different strengths of location, but instead of using nylon or some of the other materials that get used, we're using Pekkton. it's a massive resistance to wear and abrasion. So we're expecting these interfaces to last a lot longer than the standard locator, say, interfaces. So this is what we'll see more and more of over the next few years, is more uses for Pekkton. Not so much maybe the implants, but definitely more interfaces on abutments. So this is a case that we've done where we've used Pekkton in a denture on the lower and ceramic teeth and composite on the upper. And it's not, the materials are not there to replace anything, they're just to add to your toolbox. So, I still do a lot of zirconium oxide crowns, especially on natural teeth, still do lots and lots of Emax, and even on even metal ceramic, we do lots of metal ceramic still, but when it comes to certain cases, especially larger implant cases, our sort of standard modality of treatment these days, the one that we look to is for Pekkton. So while perhaps if I was doing a 6-unit anterior case on natural teeth, it would be probably the last material I'd look at. I might go to Emax or zirconia for that, but when it comes to full arch or anything on an implant, then we always take a look at Pekkton. And like I say, for our full arch cases these days, it's pretty much 90% of everything we do is now on Pekkton frameworks. So I mentioned there that we had ceramic teeth stuck on the upper. So the reason that I came to that conclusion is I am a ceramist, and not what I do at the bench every day is I layer ceramic. But I saw the future of implant cases, and we'd need to switch to some sort of polymer, and the benefits that brought to the lab. But then I thought, well, if I want to do ceramic, I think nothing beats ceramic in terms of how it looks in a patient's mouth, especially on large cases. And what do we do when, say, for instance, an Emax crown? When we're cementing an Emax crown to a tooth, we're using a dual cure resin like Multilink or something like that, and all that really is a composite. So if we can cement Emax crowns with composite, and this chart here is saying how composite adheres to Pekkton, and what it actually does is 3 times the industry standard strength on the majority of composites on the market. So basically, Pekkton likes composite. Emax, you cement that on with composite, so put the two together and you've got a perfect bond. So it's easy to process the Pekkton to receive Emax. All we need to do is apply, we smooth the surface with a sandblaster, 110 mesh alumina oxide. Once that's done, steam clean it, because it will not soak any water in like a large zirconia frame would. And then what we can do is we can treat this material with a primer. And what the primer will do, it'll give us a massively increased bond strength for the composite. And we tend to use the VisiaLink from Reddington. It's a great product, it works really well, but you can use pretty much any composite or any linking material on the market. But the one we use is Reddington VisiaLink. So if we want to do a standard type workflow on crown and bridge, it's easy, we can mill, as we've done with this small framework. And you can see the size of the connectors there. Just long and flat, so we can still get some contouring in, and then we can just veneer straight onto that. We don't need to use an opaque, we don't need to colour the framework, we just use VisiaLink and then put the composite straight onto it. So it's easy workflow, it's very easy. With some of the other polymers that are bright white and things like that, then you have to start colouring. If you want an A2 crown, you've got to use A2 opaque, and then it's just an added step. So this is really quick and simple. We do not do that much in terms of composite layering on top of our Pekkton. We tend to stick to the implant cases, and then we tend to stick individual crowns on those Pekkton frameworks. So this is how we'd approach a full upper and lower implant case. We have 12 teeth on each arch, Emax crowns, so all the lowers are completely full contour and stained and glazed, no layering. All the upper posteriors, again, stained and glazed, no layering, and then just some basic layering on the anterior 6. So we're using the strength of the materials. We're using Emax because we know it's a strong material, and we're getting the beauty of the ceramic as well, and then we cement the whole thing together on the Pekkton framework, and that can go direct to fixtures. So once we've got the Pekkton teeth luted, then the next stage, because we want to put some composite up to those teeth, is I'll etch around the margins. I cut in a CEJ with my burrs and then etch around those, and that gives a definite finishing line. And then once I've etched, I use a ceramic primer, and then we just go straight then to the pink layering. And once the pink goes onto the case, it brings everything to life. And we've got a very natural looking set of teeth. These are what we call at our lab. We have 3 standards. We have straight and white, we have age appropriate, and we have natural. Now, age appropriate is what it says. If it was like for a 70-year-old patient, we'd put all sorts of fillings and stuff like that in there. And this is more to do with natural. So it's not quite straight, it's not quite white. It's just got some, characteristics in there. And then a very pleasing aesthetic result, and we can take that to surgery and see how that works out in the patient's mouth. So what we've got there is 2 Pekkton arches on combination. I think it's 2 all-on-4s, straight to fixture. So we have titanium inserts, Pekkton processed onto the titanium, ceramic teeth, composite gums, and a nice result for the patient. And we're doing, I'd say, 90% of our, at least 90% of our bridges now are implant bridges. Whenever they need some pink gum on them, we do this modality, ceramic teeth, pink composite. If we're going straight to fixture without any pink gum, then we would do composite layering on Pekkton, or we'd go back to chrome, cobalt, or titanium. Yeah. So, again, just another view of that case. And again, we do the same thing, so it's not just like a one hit. We start off with a Pekkton framework. We have some ceramic teeth layered at the front and full contour posteriors, so we're getting all the strength there. We lute it down, and then we can put the pink on. And again, this is another all-on-4 case. There's lots of these in the UK. It's a big market for all-on-4s in the UK. And like I say, I'm not 100% fan. I think 6 fixtures is better than 4, but we're just technicians. We deal with what we're given. But the point is that with the other materials, when you've got larger spans and larger cantilevers, you have to put a primary stability bar in there. And with Pekkton, we don't need to do that. And we get, again, a nicely finished ceramic result and nice pink composite there. And send that off to the patient. And again, a natural result that you wouldn't necessarily presume was polymer. When I see a lot of the polymer cases presented, either in magazines or even at the stands, you look at them and they've definitely got a plasticky feel to them. And by cementing individual ceramic crowns on there, you get completely away from that. So I think you get a much more natural result. And just to finish off, again, another case utilising the exact same treatment modality. So we start with a patient who needed some extractions and needed a complete shift because he was in class 3 when he originally came to us. Some teeth, as you can see on this next slide. Needed all the teeth needed extraction, but we needed to stabilise this patient first. So get him from class 3 back into some sort of normal relation. That was done with some temporary crowns and a transitional denture. And then once the patient was stabilised in the new OVD, we were happy then to go ahead with fitting in with temporary restorations and clearing those arches. And same again, he comes back to the lab. We make ceramic teeth, we make a Pekkton frame, we cement it on. It's solid, it's all one unit, and then we can make the gums. And once we have all the gums in place, I've got a finished restoration. Everything, because I've etched the teeth margins, is sealed as one unit. You don't get any leakage between the teeth and the gums. So when we've done lots of Peter Worley style bridges, which is with the individual teeth on in the past, where we've not had this result because we've not been able to keep the margins clean. So another thing that we do is if we've got access holes coming through the occlusal table of the teeth, before we press the Emacs, we put a hole in the Emacs so we can have everything as one sealed unit. No clinicians having to cement these individual crowns in. At chairside, they just screw it in and put some composite to fill the access holes. And again, it works really well. This is again more of an age-appropriate setup that's got more characterization in than generally we do, but this patient wanted the teeth to look natural rather than false, and that's what we hope we give him. And again, full up and lower, all on 4 cases. So again, all full contour on the lowers, stained and glazed, and then just layered on the upper anterior 6. And happy patient means happy dentist, and that makes me a happy technician, because that means I'm going to get paid. So 1 minute early. Any questions? Any questions? No? Yeah.
Just a second. Okay. Hello.
Hello.
My name is Fouad Fakir. I'm a dental technician.
Hi.
My question is, you said if the structure is small, better you mill it, and if it's big, better you press it.
Yeah.
Why? What the difference it makes?
Because we have to make a framework anyway in order to copy scan it. And by the time we've made a framework, that takes all the time, so it's easy just to put it in the oven and press it. With the smaller cases, we can just digitally design everything. But when we've got this level of accuracy with these all individual ceramic units, to design that completely digitally is beyond my skills. And we just find it easier and so we have to make a framework. And then if we copy milling it, it's fine, it works. But while we've got the framework there and we have a presser, invest it and press it, you're working on it within a few hours. Faster, yeah.
Another question, please. For the furnace to press,
yeah.
Does it work just with the Pekkton furnace, or we can use another furnaces you have already in the lab?
Yeah, you can use, if you have a 4-2 press, the Breedent pressing machine, that works. And if you have the Dikema Pressident, that works. But it doesn't work with, say, Ivoclar ovens. You can't press. There's not enough power to press in the Ivoclar ovens. You need quite a lot of power, because when we melt these ingots, they go to almost like a chewing gum consistency, and it's quite tough, and you need a lot of force because you want to get no air trapped in there. So it's in a vacuum chamber, sucks all the air out, and then really pushes that plunger down. So you need a lot of force. I think there's a Zubler oven that'll do it as well, the Zubler presser. But we've got the Dikema, we don't use it for pressing Pekkton anymore. We just use the Pek press. I think it's maybe €2,500, so it's not a massively expensive piece of equipment. And it just means that we get no mispressings at all. We get everything that we expect from the machine. It's been made just for pressing Pekkton. But you can press other polymers in there as well. But I'm honestly saying we don't use any other polymers nowadays. We used to use a lot of bio-HPP, and since 2 years we've not used any. We just use pure Pekkton now for our polymer cases. Anybody else? Okay, thank you.
Thank you. Phil Reddington, thanks for being with us. Thank you for sharing your experience and your insights.
Thank you
very much.